Hey everyone, today we are treating a patient, basically some full face filler treatment. So she is a younger patient who was having some complaints of like her nasolabial fold area, like the piriform space, and then kind of like her lower pre-jowl sulcus area. So obviously you can tell it's really not that bad. She just wanted kind of like a little bit of a pick me up to fill in the area. So I decided to use a lighter product and use a cannula to kind of just go in and put like a little bit of filler in all of these areas where I did see some shadowing when she was sitting up. To ensure that I was giving her the best result possible. Plus, she does have a little bit of a fuller face and thicker tissue, so I didn't want to add a really heavy product to her face because I didn't want her to appear fuller or heavier in any of these areas, so I'm using a lighter filler. Clearly struggling with the cannula a little bit in this area, but it happens to the best of us. She also, again, is young, has great collagen, so her tissue is a little bit harder to get through when you have nice collagen and structure underneath your tissue. I would have probably gone in and just filled her piriform space deep down to bone. But I did ultrasound her prior to injecting, and I didn't love where her facial artery was. It was a little too deep for my liking in that area, and I didn't want to risk any kind of potential complication. So that is why I am keeping my filler more superficial in this area and using a cannula to be as safe as possible. Then I am using the same insertion pilot hole and just going kind of down into that pre-jowl sulcus area. She didn't really need much of chin filler, so I'm just kind of filling in the area right over the mental foramen to give her some structure and support there and to limit the appearance of a jowl in that area. This area can always be a little pinchy, little sensitive to get through. So just kind of move slow with it. I always warn the patient. And you can see even though I am using a cannula, it's a 25 gauge cannula, I always aspirate before I start to inject. The markings I kind of just drew like when she was sitting up, allow gravity to kind of help me in the situation. I was just kind of drawing where I saw the most shadowing. So those were the areas I knew I wanted to place the most amount of filler. She also did not listen to her pre-op instructions, and I can say that because she's one of my coworkers, so she knows better. And she used her tretinoin the night before getting injected. So as you can see, her face is very dry and very splotchy, very red, especially with using alcohol on the skin. Her skin did not like that. So this was the main reason why a good example, I guess, of why we say to avoid tretinoin or retinols, vitamin A's, anything like that, any actives like that for at least 2 nights before getting injected so that your skin isn't so dry and sensitive and splotchy. So just going in, doing a little bit. This isn't an area that I love to fill, the nasolabial fold, because adding more volume to this area can in turn just make it heavier. But she has really good cheek and mid-face support, so I didn't really need to add more there to kind of counteract the nasolabial fold. So I went straight into the nasolabial fold instead. And then here I'm just creating another pilot hole so that I can go in and kind of do a little bit in the mid-face area just to try to pick up that nasolabial fold a little bit more. And I'm staying really deep so that I can kind of get into the piriform space a little bit without going in with a needle and risking any kind of potential complication. So again, always aspirating. I typically always try to hold my aspiration for at least 6 to 10 seconds. And then low and slow pressure, retrograding out. So always keeping the cannula moving as I'm injecting filler. You can see I'm kind of moving my non-dominant pointer finger along with the cannula as I'm pulling it out, because I'm always feeling and seeing where my tip is. So I know exactly where the filler is being placed. So just going in a couple areas there. Obviously, it looks like she has some blanching to her skin, but I promise it's just because of the tretinoin reaction and the dryness to her skin. It was making me nervous as well when I was injecting her, but after the fact, I did a really good massage and I did cap refill checks all across the face to ensure, and it was honestly just because of her tretinoin and the skin reaction as to why she was having such blanching or blotchiness to the skin. Now I'm using, again, the same pilot hole, but just going in the opposite direction. So kind of going back along the lateral zygoma and giving some volume in that area as best I could. She didn't need much at all. This is just kind of a little bonus. Just doing a couple injections, staying pretty deep on the bone here to give her a little bit more structure and support. And I think I used 2 syringes total, or like 1.5 syringes total between both sides. So it wasn't very much product at all. She didn't need much. It was a light product. So that just kind of filled in those areas there. Obviously she's quite swollen, very red. So keep that in mind, but going in with some arnica gel and just kind of massaging over all of the areas that I filled to ensure that there's no major lumps or bumps and it all feels nice and smooth. And then, as I said, once I was done doing this, I did just kind of check her cap refill everywhere, make sure everything was perfusing nicely, and that she didn't have any issues. And that was it. We will follow her over the next couple of weeks to see her final results then. Thanks so much for watching, everyone, and I'll see you in the next one.